Hello, I'm Kristina Amelong from the Optimal Health Network, and today I'm going to talk to you about enemas and pregnancy. Constipation is very common among pregnant women, but is best avoided. It's important to have a full bowel movement every day. Constipation is usually minor during pregnancy, but it can be quite severe, and it is very much best avoided because it can lead to things like anal fissures and hemorrhoids, which you absolutely don't want. Constipation is caused by prenatal vitamins, by changes in hormones, by pressure on the colon from the baby. It's important to be as comfortable and pain-free as possible during pregnancy. So avoiding constipation can be a core part of taking good care of yourself during pregnancy. So are enemas safe during pregnancy? There's not a lot of scientific research pointing to that. That's been done, but over the 20 odd years that I've worked with women, I see that enemas can be very helpful to avoid constipation and to deal with the issues that pregnancy can cause with the colon. So I have determined that enemas are absolutely safe during pregnancy. If you have any concerns about this, you can definitely check with your medical doctor to determine what's right for you. The issue with enemas or constipation, one of them around pregnancy, is stimulating preterm contractions. And with all the women that I've worked with, I've never encountered enemas causing preterm contractions, but that is the concern with enemas. But we do have a testimonial from a woman who used enemas during pregnancy, including coffee enemas, because it really helped her with the issue around her missing MTHFR gene snippet and her methylation issues. So we're going to attach that to this video, as well as put some of the text into the video now. So, how do we take enemas and how often? We recommend a 3-step process for enemas to cover multiple bases and not just emptying the colon, but optimizing electrolyte levels, nurturing the mucosal lining of the colon by supplying butyric acid, and supporting the liver. So our 3-step enema series process that can be learned about in another video that we have linked to here. How often to do enemas is really based on your personal needs. Some women are going to be doing enemas every single day because that's what helps them feel great during pregnancy, and that can be incredibly safe for them. Other people are going to do it just when they encounter constipation, or once a week, once a month. So that's really an art that is up to you, but you definitely want to make sure that you're pooping every day. And we'll also link below our poop everyday article in our Bristol stool chart, so you can kind of track what's optimal for you. If you decide to use enemas, it's helpful to be as relaxed as possible during the process. It can be really nice to take an enema in an salt bath with lavender oil. I recommend that. And also, if you experience any pain or discomfort during the enemas, do stop doing that. So if you find that enemas aren't the kind of process you want to go through to help you with the constipation, we do have other alternatives. So supplements like vitamin C, magnesium, digestive enzymes, and probiotics all work as like legs of the stool to support the body to optimize your bowel movements. We do not recommend taking harsh laxatives like senna or Cassara sagrada, because those for sure can stimulate. The whole point of those is to stimulate the muscles of the body to contract. So those can also contribute to preterm contraction. So do consider a combination of things like magnesium, vitamin C, each of those which have a bowel tolerance. If you take up to a certain amount, you actually would get diarrhea, so you can titrate them up slowly to get your optimal stool flow going. And then also it helps to digest the food and to move the bowel. The digestive enzyme, very simple formula, pancreatin, ox bile, and black radish root. And then it's always important to keep your microbiome balanced and thriving. So we do recommend taking a probiotic during pregnancy. So those are all alternative tools to both enemas or harsh laxatives. Of course, lifestyle and diet are core to a healthy pregnancy as well. So drinking plenty of fluids, taking in plenty of healthy salt, sea salt, Himalayan salt, as well as eating an optimal diet of generous amounts of fruits and vegetables and good quality proteins and healthy fats, and avoiding things like gluten, pasteurized dairy, sugar, alcohol, that can all contribute to an optimal pregnancy and optimal flow out of the colon. Exercise is also something that really helps optimize good, healthy bowel movement, so do keep exercising even during your pregnancy. If you have any questions or need support during your pregnancy or using enemas during your pregnancy, please do reach out to us at optimalhealthnetwork.com. We're here to help, and I do a consultation process that's very affordable and can make a big difference to your pregnancy. So reach out to us at optimalhealthnetwork.com or give us a call at 608-242-0200. Take good care.